kept this virus from overwhelming our healthcare delivery system, and I want to thank the people in this city for their efforts. Our efforts have saved lives and prevented our local healthcare system from being overwhelmed. I don't want us to lose sight of the fact that the virus is still in our community, and I think we all recognize that. And I do not want anyone to let your guard down or not think that the virus is no longer a threat to our health and safety and the health and safety of our family, friends, and neighbors. And as a reminder, today the Houston Health Department is reporting 139 new cases of COVID-19, bringing the total case count for the city of Houston to 5,795. The total number of deaths in the city of Houston will increase by 1. So we're reporting 1 new person who has died as a direct result of COVID-19, and that brings the Houston count to 115. This is a white male in his 80s with underlying health conditions who passed away on April the 22nd. And so as you can see, we must continue to remain vigilant even as restrictions are being lifted, and we must contain the spread of the virus and keep Houston safe. As the state of Texas moves into phase 2, continuing to go to restaurants whose occupancy restriction now goes to 50%, to bars and summer camps, bowling alleys, and concerts, and back to work. Please, let me emphasize the importance of wearing face coverings and practicing social distancing and good hygiene. All of those things will be critically important. And as more businesses reopen, Houston will benefit from easier access to free COVID-19 tests. The Houston Health Department and its partner agencies are providing 113 testing sites across the city this week. I said 113, 13 testing sites across the city this week, focusing on vulnerable communities. And there's a map with all of the locations, and I want to thank the Texas Division of Emergency Management, which is working with the Houston Health Department on 4 drive-through test sites at these various locations. And also this week, Kroger Health and the Health Department will operate a free drive-through test site at the Acres Home Multi-Service Center at 6719 West Montgomery Drive, and that will take place from May 19th through the 23rd. And United Memorial Health Center and the Health Department will extend operations at an existing site and open 5 new drive-through sites this week at Funwood Early Childhood Center at 9709 Mesa Drive, Forest Brook Middle School at 7525 Tidwell Road, United Memorial Medical Center at 510 West Tidwell Road, Cullen Medical Center at 6900 Scott Street, and Griggs Elementary School at 801 Regional Park Drive. And as we move forward for the rest of this month, the goal is to open a total of 24 testing sites this month, and to increase the number of tests that will take place in the city of Houston. And again, let me encourage everyone, whether you are symptomatic or asymptomatic, whether you have symptoms or no symptoms at all, let me encourage you to take advantage of all of the free testing sites that exist in the city of Houston. And so let me pause at this point and bring up Dr. Peirce for his report. Dr. Peirce.
Thank you, Mayor. 2 things I'd like to talk about today is we talked earlier about a week or 2 ago about a new complication, well, not new, but a complication of COVID-19 disease. We mentioned that it was a complication seen in children similar to a known syndrome known as Kawasaki syndrome. For this particular virus, the COVID disease, it now has a name. It's called multi-organ inflammatory syndrome associated with COVID-19. It is still a rare complication. In New York City, where they have many, many, many cases, there's about 100, I believe 102 cases. This is a childhood illness. In New York City, I said about 102, and I think across the rest of the nation, there may be 24 others. So it's still rare, but it is potentially very serious. And so for parents, if your children become seriously ill for no apparent reason, including fever, and then unfortunately the other symptoms can be quite varied because this appears to affect pretty much every organ system, hence the name multi-organ inflammatory syndrome. The children are quite ill, however. So if your child becomes significantly ill with fever or even without, you need to contact your pediatrician right away and get that child treated. Again, this is a very rare complication. So in Houston, to the best of my knowledge, we have not had any cases here in Houston, but I advise parents to keep a close eye on your children. Remember, children tend to have little or no symptoms, so you may not even know if your child was infected with the COVID virus before that. And the other thing I want to mention today is last week, on Wednesday of last week, the state issued guidance for labs that, as Mayor, you've been pointing out our frustration with not knowing the total number of tests that have been done. And previously, only positives were required to be reported to the local health department. That has now changed. The state has issued that all tests, so anybody from a lab who's listening, all tests need to be reported to the local health department. And the health department that the test gets reported to, whether positive or negative, is based on the patient's home address. Now, here in the Houston area, our health departments work very well together. So if you send it to Harris County, it turns out to be a City of Houston case, we'll take care of that. But you should try to make it local. In other words, please don't just send all your results to the CDC in Atlanta, because that will induce a huge delay. Don't send them to Austin, because that will induce a huge delay. If the tests are done locally, either try to send it to the appropriate, would be Montgomery County, Fort Bend County, Harris County, or City of Houston, Galveston County. Please try to send it to the appropriate health department. It's very important. And then finally, back on the multi-organ inflammatory syndrome, that is a reportable illness. So any doctors or nurses who are watching, that is a new illness. It's a new addition to the reported list, and it's required that you report that to your local health department. Mayor?
Thanks, Dr. Peirce, and we'll take any questions that you may have at this point.
Hey, Mayor. I am asking for all the full folks today. From KHOU, they would like to know about the mask issue, of whether or not it appears wearing masks, whether you choose to or not to, have become political, and they want to know, are you concerned that because of that, perhaps more people are choosing not to wear a mask, and if you're concerned that that may have an effect on cases?
Let me just say that wearing masks should not be political. I just listened to the governor's press conference, as well as to the head of the Health and Human Services at the state level. They all were recommending that people wear masks or face coverings. I'm wearing a mask. The Mayor Pro Tem, well, he's wearing a mask. I just knew you were wearing your bandana. Okay, he has his bandana. And so it shouldn't be political. I mean, I'm affiliated with one party. The Mayor Pro Tem is affiliated with another, and we both have face coverings on. The reality is that this virus has no respect of persons. It doesn't care whether you're a Republican or a Democrat. Many of the people that have been infected by this virus were Democrats and Republicans. Many of the people who have died have been Democrats or Republicans. And if anyone questioned that, just continue to get in large groups and don't wear face masks or face coverings and see what happens. This virus is not going to skip over you because you are a Democrat, and it's not going to go around you because you are a Republican and just go at the other. It should not be political. Certainly in the city of Houston, I would like to think that the way we have handled this particular situation since the first week in March has not been based on whether or not whether or not one was affiliated with one party or another. So I will tell you that it works. The face coverings, the face masks, they do work. And because what people have done collectively, lives have been saved. I do regret that at times it seems as though it could take on a political what's the word for it? Flavor, so to speak. But I regret that because in the end, I think in the end, the virus is going to remind us, I didn't tell you which party I was affiliated with. If you were living and breathing, I got you. And I think that's what's going to happen at the end of the day.
Mayor, can you give us a reaction to what the governor has authorized as part of his phase 2, for example, sports teams, youth camps, summer school? What are your thoughts to his announcements an hour ago?
Well, now, let me just say from the vantage point of the city of Houston, we're going to do everything on our part to make it, to try to make the what the governor has said, make it work, to keep everybody safe. So we're going to do everything on our part to achieve that overall objective. The people in the city of Houston, and I speak, myself, we want things to open up. We want the economy to open up. We want people back on their jobs. We want businesses open. So let there be no question about that. I probably would choose a different pace than what he has chosen, because now, bars and bowling clubs and youth sports camps, summer camps, things of that will be opening up. My only hope and prayer is that several weeks from now, we are not going to see a spike occur. And at the same time, just because anyone, whether it's me or was the governor, was anyone else, say things are open, I think people are going to exercise their common sense, and they're going to do those things to help protect themselves and their family members. And that's what I have seen over the last 30 days. What I will say is that there's been this statement made that the percentage of positive cases has come down, less than 5%. Let me just say this, in response to that. In March and April, if you all can recall, we were primarily just testing people who were asymptomatic. Okay, we were just testing people who had symptoms, tightness of chest. What was the other elements? Fever, cough, those things. So for the months of March and April, we were just testing people who were symptomatic, had signs and symptoms, which means that denominator was very small. And so when people tested positively, you had a very high ratio. And then you notice in the city of Houston, we started testing everyone, whether you were symptomatic or asymptomatic, whether you had symptoms or you didn't have symptoms. And in the last, let's say, 30 days, we have increased the number of tests. In March and April, we weren't testing nearly as much. Now and in the last 30 days, we have exponentially increased the number of tests, and we are testing everybody, symptoms or no symptoms. And so rightfully so, your numerator is going to be at X, and your denominator is going to be X plus Y. And so your percentage of people testing positive will be lower. Now so you can't, we're measuring apples and oranges right now, so you can only determine whether or not that percentage has dropped if you're taking the same number of tests that were done back then, and you were only testing symptomatic cases. I hope I'm not being too confusing.
I think, Mayor, a lot of people are rightfully confused by the numbers, because I think we hear them from city, county, state, and the TMC, and the numbers are different. Maybe you and Dr. Peirce can specify, in the Houston area, are our rate infections increasing or decreasing? Because our sheer numbers, is it still flat? Is our curve flat, up, down? Is there a simple
Let me just say
way
this,
to-
and I'll bring up Dr. Peirce. Have we flattened the progression? Yes. Okay. Has what we have done collectively worked? The answer is yes. Have lives been saved? No question about that. Okay. Has the virus disappeared? No. Is there a vaccine right now? No. And if we come together and treat this virus as if it's yesterday's news, do we run the risk of fueling this virus and facing another spike or several spikes down the road? I believe the answer is yes. But let me defer to Dr. Peirce.
Thank you, Mayor, and thank you, Mayor. You know, you're exactly right. But the good news is that we have a lot of people working very hard and collecting data. The bad news is that then creates a variety of different sources, and they don't always say exactly the same thing. So when I look at those different sources, what I see is that the trend, while the numbers are different, the trend is similar. And the trend is basically that we've got a very flat, maybe even a slightly decreasing, but basically a pretty flat indication of the activity of the virus. And the mayor's right, as more testing gets done, more sites, more tests being done, the raw number of positive tests will go up, but the percentage is what we need to watch. And so right now, Houstonians, I think, need to be proud that they have done a very good job. As we move forward, because the number isn't zero, the virus is still in the community and it is still being spread, because if it wasn't spreading, then the number would have dropped to zero and nobody would be testing positive. So while the different sources of information can be confusing, if you look at what they really sort of say as opposed to the actual number, they're saying pretty much the same thing, that the virus is out there, it continues to spread, Houstonians are doing a good job, but we need to remain vigilant as we change our daily activities. We need to not lose the benefit of the lesson we learned over the last several months about how we can be effective at slowing down this virus.
Well, would you recommend Houstonians go to gyms?
Go to gyms?
And
So I'm not going to go to a
summer
gym.
school?
I'm not going to go to a gym, and I'm not going to go to those sorts of things, not yet. I personally, I just don't feel comfortable doing that yet.
Let me just say that when you've been cooped up, pent up at your home and not working, and you've been laid off, it is in many ways it's popular to say, okay, you can now go out and play. Okay, when you've held people in their homes, and now someone else comes along and says, okay, you can now go out. That's a popular thing. People want to hear that. No one wants to hear people say you continue to stay home and stay away from the bars and all of it. Nobody wants to. Many people don't want to hear that. And this is the sort of virus, for example, that you don't see the impact for 2-3 weeks down the road or a month down the road. My hope is that everything that's taking place in our state will work. And my hope is that we can reopen and we won't see any additional spikes. And as the mayor of the city of Houston, what I will say is that we will do everything within our power to keep people safe and work in such a way that we don't see a spike. And we're going to hope and pray that things will go well, and that a month from now we won't look back and start second-guessing anyone. So that's how I choose to look at it. What I will say to you is that the wearing of these masks and the wearing of face coverings and the social distancing, all of those things remain even more important today, and as we go forward and reopen, than they were in March and April.
Just going through some other questions from the Houston Chronicle, Mayor. They want to ask, will the city save any money due to the COVID-19 pandemic from things like lower electricity costs, from closed down libraries? If so, would that be factored into your budget?
Say that one more time.
I think they were saying, like, you know, libraries being closed and things like that, that may have saved electricity, and will that be, any of those savings be factored into your budget?
No, the lights were still on, whether there was one person in there or 50 people. The employees were still working. They were redeployed. I will say that we are looking at how we can take the cost of that deployment and factor that and put a number on it, and then pull that from the federal CARES money to go into the budget. So we're taking a look at that, and we do anticipate us being able to do that. We're just trying to determine exactly what that amount will be.
Would that impact fewer furloughs? Would that? Is that a workaround you're looking at?
The priorities in terms of filling the holes would be the police cadet classes. You know, that's public safety would be a number one priority, followed by, for example, the Economic Stabilization Fund with hurricane season quickly approaching, then returning the fund balance to 7.5, and then reducing the number of furloughs. That pretty much will be the order.
The Chronicle would also like to know if you're considering any additional fee increases besides the garbage fee that you passed?
Other
The
than,
can rental or?
other than the revenue measures that are already included in the budget, I'm not anticipating having to, looking at any other fees.
From KRIV, they want to know if you're taking any steps to extend, or I don't know if you would have the capacity to influence the eviction moratorium that was lifted as of today?
We don't have any authority over that. I know the Texas Supreme Court is bringing their halt on evictions to an end as of today, May 18th. I have asked them to extend the halt on evictions through the end of this month, but they have not acted on that. We don't have any power over the Texas Supreme Court.
And also, what have you heard, or have you spoken to the Archdiocese about the Holy Ghost Catholic Church in the Gulfton area, where they reopened? This is from KHOU, I apologize. On May 2nd, and 3 people have since then tested positive for COVID, and then they had to shut it down. And they made an announcement telling everybody, if you went to Mass, you have to.
Well, that's the point,
Self-quarantine.
and that's the point, Maya, that we're trying to emphasize. This virus is still very much here, and that people have to exercise some common sense and good judgment. And look, a lot of what even what the governor says has said, and what others are saying, in the end, personal responsibility does go a long, long way. And just because something is open, I think you have to make the decision as to whether or not you're going to go in. And if you go to some place, for example, and people don't have on their face coverings and their masks, and they're not engaged in social distancing, there's no one telling you that you need to stay there or you should stay there. You can exercise your judgment and turn around and walk out. But the social distancing is important. The face coverings is important. The virus is still very much here. So as the state moves to reopen, how we choose to do that, and the manner in which we choose to do that will determine whether or not people will become infected by this virus.
And Mayor, would you just say overall, are you encouraging every Houstonian to go get tested, or every Houstonian who wants to go get tested, get tested? Like, where are you as far as?
Well, I encourage Houstonians to go get tested. I think it's important, even though, the test is not a vaccine. It doesn't say that, next week you will not have come into contact with someone and where you may have obtained the virus. But let me tell you, I felt good after I got tested. Okay, I think Mayor Pro Tem will tell you, but I will tell you, for just my peace of mind, and I deal with this every day, and I'm out and about almost every day, and I'm telling people, test, contact tracing, all of that. I decided to go and get tested, and the people around me decided to go and get tested as well. And it was not, how can I put it? It was not a scary experience, although I did like this, because I thought I was going to do it myself. Dr. Perch told me I was going to be doing it myself. He lied to me. But when I got there, they told me to lean my head back, and I asked the nurse. I said, you gonna give me the swab? She said, no, Mayor, just lean your head back. And I leaned my head back, and I closed my eyes. And 15 seconds later, it was over. And I will tell you, as soon as it was over, I felt pretty good. And I will tell you, 2 days later, when I got the results back, in fact, we were all in an executive meeting together. Mayor Pro Tem, phone went off first. He gets up and answers his phone, and he comes back and to the table, and he says to the rest of us, I was negative. Well, I immediately looked at my phone to see whether or not they had contacted me. And they had, and I left the meeting, stood up, and went to another room in case there was, it was not, good news for me. And they told me, that I was negative. And I felt even better then. And so what I would say to you, just for your peace of mind and just an added level of knowing that you are not, at that moment in time, in proximity with somebody else, and you can spread the virus. It made me feel good. I would encourage Houstonians, especially as we prepare to move forward. For child care facilities, restaurants going to 50%, bars and bowling alleys, youth sports camps, summer camps, professional sports, summer school, all of these areas that are now starting to open up. If we're going to do that, and it appears as though we are going to do it in the state of Texas, then the added level of comfort that people will have is getting tested, making sure we're working hard to put contact tracing in place, and then making sure we have the infrastructure to isolate, quarantine, and treat if necessary. I strongly recommend it.
Thank you, Mayor.
Okay? Does that do it? Let me thank you all. Appreciate it. And don't forget about the citywide high school celebration that's coming up on June the 5th. I shall have on my cap and gown. All right. Thank you all.